This next section is going to talk about urine volume and urine constituents. So there are some hormones that regulate our urine volume. Why would we have to have more or less urine volume? Well, another function, in addition to just secreting wastes out of the body or excreting wastes from the body, from the bloodstream, out of the body through urine, is the regulation of acid-base balance, regulation of electrolytes, and regulation of fluid balance. Blood pressure can also be affected by the regulation of urine volume. So there's a lot of other things at play here that play a role in our kind of hormonal regulation of urine volume. If we have too high of blood pressure, one reason for having too high of blood pressure would be that we have too much water in our bloodstream. So in order to decrease our blood pressure, we just pee out some of that water. So there's hormonal mechanisms at play that can decrease our blood pressure by increasing our urine volume. If we need to pull extra waste products out of the body, then we may increase our fluid output in order to draw those nutrients out with it. So I'll talk a little bit about the RAS system. And this is a review from the endocrine system when we talked about this previously. But the renin-angiotensin-aldosterone system is in response to elevated blood pressure. So renin is released by the kidney, and renin will be converted to angiotensin 1, and then angiotensin 1 will be converted to angiotensin 2, and angiotensin 2 directly stimulates the release of aldosterone. Aldosterone is then going to cause an increase in the reabsorption of sodium. And when we reabsorb sodium, water is going to passively follow. So now you got more sodium being sucked back up in the body, more water is going to be sucked back up in the body, and that's going to increase your blood pressure. The RAS system is going to decrease your urine volume. A couple other hormones that play a role in urine volume are atrial natriuretic peptide. Atrial natriuretic peptide is released by the atria of the heart in response to high blood pressure. So if the blood pressure is too high, this stimulates the release of water from the urinary system. So this is going to increase your urine volume. Because if your blood pressure is too high, one way to adjust for the elevated blood pressure is by peeing out more water. So this one will cause an increase in urine volume. Antidiuretic hormone is another one that we talked about. An antidiuretic hormone is on this side of things, ADH. It's going to cause a decrease in urine volume. We are keeping water up in the body. Under normal circumstances, our urine composition is about 95% water. Then there's some nitrogenous wastes, electrolytes, occasionally bacterial toxins, pigments, especially urochromes. Hormones are shed in high levels. But then there can be some abnormal constituents, such as blood glucose, albumin, casts, or calculi. So urinalysis, I'm going to show you a picture of this. Excuse me. So in a urinalysis, it's usually done with a dipstick test. So there's a strip of paper with all different little squares on it. You dip it in the patient's urine, and then you hold up that strip to all of these different tests. And you compare the color changes on your test strip to what you're seeing here to get relative values of diagnostic information from the patient. So what's on a urinalysis stick? Well, first of all, urobilinogen. If you have high levels of urobilinogen, that means that you have poor liver function or hemolysis. Urobilinogen is a pigment that would be found in red blood cells. So if that's released suddenly, then that would indicate your liver is not filtering that out of the blood properly, or somehow, for some reason, you're having excessive hemolysis. Bilirubin. Elevated levels in the urine could indicate liver or gallbladder dysfunction. If ketones are present, ketones are produced when the body uses fat for energy instead of carbohydrates. That can happen in the case of somebody that's dieting and avoiding, like with a strict no-carb diet, or if they're diabetic and they can't use their carbs. If there's blood on the urinalysis, that could indicate kidney damage. Protein, consistently large amounts of protein could indicate kidney disease or hypertensive diseases. This is especially important during pregnancy, which could indicate preeclampsia. Nitrites can only be formed by bacteria. So nitrates with an A can be produced by people, but nitrites with an I are only made by certain types of bacteria. So if you have nitrites in the urine, that would indicate that there's bacteria present, which could indicate a UTI or urinary tract infection. Leukocytes or white blood cells in the urine could also indicate a urinary tract infection, could also indicate some type of bladder cancer. Glucose could indicate diabetes or kidney disease. The specific gravity has to do with the relative specific gravity compared to water. So if you have higher specific gravity than water, that means that there's more solutes. In other words, you're dehydrated. So the higher the specific gravity, the more dehydrated the patient. That's important because if the patient's super dehydrated, all of the other levels in the urine could be off. If this patient is super hydrated and there's a lot of kind of low specific gravity, then those numbers could also be off. So it's kind of just for to ensure that there's nothing that's messing with the actual test system. pH, urine should be slightly acidic, and that's going to indicate the acid-base balance of the body. If you all of a sudden see a very highly acidic pH of the urine, that could indicate that the body is compensating for some type of acidosis. An ascorbate or ascorbic acid, also known as vitamin C. High levels of vitamin C interfere with certain test strips, so if you see that elevated, then the test should be repeated at a later time. So all of these tests and all of the stuff we've been talking about could be an indication of renal failure. And there's different stages of renal failure, and different textbooks and different physicians are going to stage these slightly different. But in general, there's two major divisions. So there's acute and chronic. Acute is rapid onset and usually short-lived. During acute renal failure, you have oliguria, slightly decreased urine output, high nitrogenous compounds in the blood, and that can be detected by a BUN or a blood urea nitrogen test. That can be caused by a sudden hemorrhage, burns, acute glomerulonephritis, and that's usually a severe kidney infection, or obstruction of the urinary tract. If you get a stone obstructing the urinary tract, you could have acute renal failure. Chronic renal failure, though, is due to a gradual loss in nephrons, and as they stage the different stages of chronic renal failure, they're going to determine approximately how many nephrons have you lost, or what is your kidney function down to. There's many causes of chronic renal failure: diabetes, infections, tumors, autoimmune diseases, obstructive disorders, polycystic kidney disease, and so many more. Certain types of medications can also cause chronic renal failure. Some of the nephrons may be able to be repaired and may be able to resume some of the kidney function, but in most cases of chronic renal failure, eventually the patient will need dialysis, and after dialysis would come a kidney transplant surgery. The stages of renal failure and so forth, and the types of dialysis will be discussed a little bit further in advanced EMP.